Welcome back. We now continue our look at the latest in medicine with a new craze in cosmetic surgery, gluteal procedures. Now that's plastic surgery to the rear end or your buttocks, all to sculpt a sexier look. You can blame it all on Jennifer Lopez. Remember that dress she wore to the Grammys? It boosted her to superstardom and made beautiful behinds front page news. And that infamous green dress also made a lot of women green with envy, and some are ready to go under the knife to build a better butt.
Marisol Rego likes what she sees in the mirror now, but it wasn't always that way.
The way my clothes used to fit before, it wasn't the same. It was like something else was needed.
And she's not alone. It seems every woman wants a bodacious backside like J-Lo or Beyonce. And cosmetic surgeons like Miami's Dr. Constantino Mendieta are making posterior perfection possible.
It's not about making the buttock bigger, but it's about making it shapelier and putting the volume in areas where it belongs.
So how bootylicious are you? Dr. Mendieta has identified 4 basic butt types.
And the different shapes are an A shape, a V shape, a square shape, and a round shape.
The A shape is the most desirable, where the buttocks gently curve out from the waist. The V shape is one of the least desirable, where the buttocks curve in. The square sort of looks, well, square, and the round is very plump and circular. A lot of what you have depends on your genes, and a lot of what you want depends on your ethnicity. So what can you do to fix imperfect proportions? Dr. Mendieta uses liposuction and a technique called fat transfer, where fat is taken from one area of the body and put into the muscle of the buttocks. And because it's put in the muscle, the fat survives for years.
But liposuction and fat transfer isn't the only way to give a little boost to your behind. Some surgeons are also using buttock implants.
They come in a variety of shapes and sizes, but complications are more common unless the surgeon has extensive experience.
My particular technique has focused on placing the implant within the muscle because it gives me more support, it makes it look more natural, and it has a very natural feel to it.
Marisol decided to have fat transfer with Dr. Mendieta, and she's happy with the results.
I recommend her 100%. 100%, no doubt about it.
But remember, booty is in the eye of the beholder.
Well, there you have it. And here to talk about gluteal procedures is Coconut Grove cosmetic surgeon Dr. Constantino Mendieta. Tino, thank you for joining us today. Are you for real? Are people really asking for this procedure?
You know, it's very interesting. It's an early craze. I think we're seeing it in the very early beginnings of the fad that's about to come. I think it'll become just as popular probably as breast augmentation, but we're still a few years away from it.
Yeah, now, who is coming in? And does it vary with their ethnicity? Like, who's coming in and what exactly are they asking for? Are they asking for a J-Lo booty?
It's cross-cultural, and it has no age limits. I've got people from their 17s all the way up into their 65s and even 70-year-olds coming in asking for this. So it really has no boundaries as to when it can be done. The wonderful thing about it is that I'm using your own body tissue to reshape, resculpt, and add more volume to the buttock. It's your own body fat.
Right. Now, whose rear end are most people asking for?
I would have to say Jennifer Lopez is definitely on the top of the page, but that's very voluptuous. So I tell them I can't get you Jennifer Lopez, maybe I can get you the J, but not the entire Jennifer.
Tell me a little bit. Now, you developed, actually, which was actually featured in the New York Times, which is fairly impressive. You developed these 4 different buttock types. How did you come up with that? Because when you look at it, you have to say there's some physiological basis to it when you look at it. So tell me about it. How did you come up with that?
It was honestly just a grueling, long year of research, and I just hated to go through. I'm just glad it's completely over. But essentially what we did is that I would sit at home with my wife, and she helped tremendously. Because she's
you better ask her before you start looking at all the behinds.
I got to tell you, I definitely had to do some help on that. But so we'd sit in bed really with 300 other women at nighttime looking at pictures, and sometimes I just couldn't figure out why they looked so different, and she was very helpful because for women, they say that they look at personality first in men, and secondly is the buttock. So my wife's been used to looking at buttocks forever. And so she kind of helped me figure it out and said, look, I think this one has a different shape, this one has a different shape, and then I'd extrapolate it from there. And every time I began to get invited to lecture at different societies, and every time I'd be preparing for my lectures, I'd notice something different or something new. And so I think over the last 3 years, it's just evolved to where now we've kind of perfected the whole thing.
Now, you mentioned men. Now, this seems like a more of a female-dominated procedure, perhaps, but are men asking for gluteal procedures?
Yeah. Oh, no question. Right now, it's about 10% of men, and I think one of the things that a lot of guys would really like to work on if they really had a chance is the buttock area. Now, interestingly enough, I'm using fat to augment the buttock, but what I do in men also is that I'll take the fat and inject it into the pectoral muscle to give him that Adonis look like me and you were talking about one time.
Terrific. Well, tell me a little bit about what the changes with age. Like, how important are your genes to your buttock shape, and also how does your behind change over the years?
Well, I think as we age, we all tend to lose fat. So we tend to deflate. We'll see it in the face, we tend to see it in the midriff, and we see it in the buttock as well. So it does tend to droop and lose a lot of its volume. So that's where we come in to try to restore that youthfulness to it and even lift it up. What was your first question?
You lost me, too. You changed with age. How about genes? You know,
the genes, actually. Yeah, that's a great point, yeah. Well, genes are very important, I think. It just has to do with where your genetics say that you should distribute your fat. And in some people, it'll distribute more in the upper buttock, and some more in the lower, more in the center in others. And so that's what develops a shape, depending on where you end up depositing more of those fat cells.
Now, there's money to be made out there in terms of exercise, and money has been made on videos to sculpt the butt. Can exercise overcome a lot of your genetic problems?
Exercise will get you in better shape. It'll improve your heart condition and your lungs, but in terms of the shape of your body, it will improve it somewhat. But if you're genetically predisposed to having all those fat cells in the upper buttock, there's nothing that's going to come out and get rid of that. Except
so diet and exercise won't help you at all.
Not for the shape.
That's right. The bottom line, I guess. Pardon the pun. Thank you, Dr. Mendieta, for joining us here on 4 Sunday Morning.